that Botox is still safe. So talk about that for just a little bit.
So Daren, I'm a board certified dermatologist and I have been injecting Botox for over 25 years. I have been using Botox myself for, I don't know how many years, probably that long, if not more. Not that more, but probably that long. And I feel very safe. I treat, both of my kids have gotten Botox, family members. It's very safe and effective. What the problem is when people who don't love anatomy or aren't trained or want to make money instead of injecting because they love injecting, cause problems. And we get inundated with requests to inject counterfeit Botox or Botox like, and it's not that. We only purchase products that are from the manufacturer who makes them. We have 5 injectors at Johnson Dermatology. All of them are trained in anatomy. All of them have worked with Dr. Brad in surgery. They have worked with me medically and cosmetically for over 6 months before injecting patients. So Botox with the proper products in the proper hands is safe and effective.
So the problem with this, and especially I think was it Tennessee, that people were going to places that really they shouldn't have gone.
Yes. So this has made it in the news and is very popular right now because 19 people in 9 states have developed pretty severe complications from counterfeit Botox or from Botox being injected by untrained people. I think it's important to state that there is no Botox certification. So a lot of people like to say they're certified in Botox or they took a day course from Botox. There's even people around here that are offering 1-day courses to inject. Well, you know, it takes, as Malcolm Gladwell or Macklemore say, it takes 10,000 hours to become good at something. And it takes a while. So even at our clinic, you have to inject for 6 months employees and be trained and work with us before we allow you to inject patients.
Do you see this as becoming a growing problem, or are we nipping this in the bud before it becomes a major problem?
It has been a problem for some time, and it is a growing problem because more and more people want injections. The cosmetic market is growing. And more people are offering injections, which is great because we all need supply. We all need, there's a big demand. We all want it. And so we need people that are trained to do it. And so last year, the FDA came out with pretty strong wording that said you should only go to get injections of Botox or filler by a trained core physician or practice. And so go to your dermatologist, go to your plastic surgeon, go to somebody with experience. The C.D.C. and the FDA came out a few days ago with pretty strong guidance to ask people to ask 3 questions. 1, is your injector licensed in their state to practice medicine? Because injection of fillers and Botox are a medical procedure, so they need to be medically licensed. 2, how long have they been doing it and what is their training? And then 3, are you in a licensed facility? So some of these complications are being done because people are being injected at houses, at spas, at not a medical spa, but a spa or a clothing store or at a Botox party. I'm a medical professional. I graduated medical school in 1996. I'm very, very good at dermatology, but you don't want me managing your heart. You don't want me replacing your knee. You don't want me giving your eye exam. I don't know how to do those things. And so you want somebody who's treating your skin to be knowledgeable about your skin, knowledgeable about the anatomy. Complications happen. Like I said, I've been injecting for over 25 years. I still have made complications, but I'm always training. I'm always trying to do the right thing. I understand the anatomy. I understand what we can do to fix those complications.
So the popularity of this, and obviously it's grown over the last several years. Mm-hmm. Do people kind of put blinders on and I just want to go get this done, and that's not the way to do this?
I think we're all excited and we all trust people. I think we're very trusting as humans. And so if somebody's offering Botox injections, you trust that person. You believe that they're licensed. You believe they're trained. People don't know what they don't know. You see it on TikTok. You see it on Instagram. This person has so many followers. They have to be good. They have a billboard. Well, that popularity should not determine necessarily who injects you. In my opinion.
Bottom line here is that folks really do need to do their homework.
Yes, ask your friends. Look at the person who's going to inject you. Do they have letters behind their name? How long have they been doing this? What do they look like? Do you like the way they're injected? At our clinic, we like a very natural look. You might not want that. You might want a very extreme look. So yeah, pay attention. Find out if you're going to somebody who's not a physician, find out who the medical director is of that clinic or spa, because you want to know if you have a complication, who's going to take care of that complication. If that medical director is hours away and something happens, can that person injecting you take care of that situation? We're very blessed at our clinic. Nina Copeland is a nurse practitioner who many of you know and who's been with Johnson Dermatology for over 12 years. She has become the region's expert for dealing with complications from Botox and fillers from people from Tulsa, from Northwest Arkansas, from Little Rock. They're coming here to see her in Fort Smith to help deal with those complications because she is so experienced. So be careful, my friends. Botox, saying I'm going to get Botox, that's like in the South saying I want a Coke. And so Botox is one brand of commercialized botulinum toxin. There are 5 commercially available products available. So Botox, I said, have been injecting for about 25 years. And then there's Jeuveau, which is very similar to Botox. And there's Dysport. And there is Daxi. And there's another one called Xeomin. Those are all great products. They all do great to relax the muscles. None of them are counterfeit. None of them are generic. None of them are fake. So just because it's not the brand Botox, you don't need to be scared. You need to be scared about who's holding the needle that's injecting your Botox. And then make sure it's the actual product. Make sure it has a package insert from Allergan. If it's too cheap, be careful because you may have to spend a lot of money to correct the problems. So.
Very good. Very good advice. And as always, very well done.
Thank you. Thanks, Daren. Always good to talk to you.